Now I'm going to show you the ReLeaf suction in action with a patient. So the first thing I'll do is set up expectations. I'll tell the patient, could you turn towards me, please? I'm going to be using a new suction that's going to really help to keep the water cleared out while we're working. And I just want to show you how this works. I'm just going to take this and the soft little leaf part. It's very soft, it's very flexible, it doesn't hurt at all. You can even bite down on it. And I'll insert it into the patient's mouth with the hole pointing towards the back of the mouth. And usually at this point, I don't turn it on yet because I don't want to startle the patient with a loud noise. I just want them to get used to the feeling of the leaf inside their mouth. All right, I'm going to gently turn this on about halfway power to get, you have the feel of it. Now, if you feel at any point like you need more suction while we're working, all you have to do is just kind of close down and it'll give you that extra suction. Does that feel okay? I'd also let them know at this point that if it does bother them or they're feeling uncomfortable with it, just to let me know and we can take it out at any time. So normally, especially when you're trying to work on the maxillary arch, moisture control is really difficult and it's messy. You end up producing a lot of aerosols, the patient ends up getting a lot more moisture on their face than they'd like, and oftentimes the gag reflex kicks in very quickly with the buildup of moisture. Not ideal. So now we're going to use the exact same conditions, same power setting with the ultrasonic scaler, same amount of water. The difference is we're going to now use the ReLeaf suction as moisture control. So I'm going to go ahead and put this in, slide that in there, and make sure nothing's pinching the cheek. We're going to turn it on, and I'll have you turn towards me a little bit. Great. And we're going to see the difference with the aerosol reduction as well as just the suction power and moisture control and comfort overall for the patient. Now, the first thing you're going to notice is a lack of aerosols. The second amazing thing you're going to notice is there is not water pooling in the back of the mouth. The leaf is pretty immediately taking care of that pooling of water. So the patient is comfortable and you're able to continue working. If you do feel like it begins to pool or the patient looks like they're getting a little uncomfortable, I would just stop. I'll have you just close down on that for me for a minute. Is that feeling okay? Great. And you can go ahead and continue your work. The ReLeaf has made a huge difference in my day. I feel more comfortable as a clinician. I feel like I can do a better job. And it makes me feel good to know that my patients are also comfortable at the same time. So I'm really recommending the ReLeaf to all the hygienists out there, everyone I talk to, and I recommend that you try it too.